Okay, it's on.
Yes. So we are live, everyone.
All right.
Okay.
Hi, everybody.
Hi, everyone.
Hello.
Hello.
Good evening, New Jersey.
Okay. So everyone, you all ready? You all good?
Yes.
All your shares?
I think.
Okay. Speight.
Yeah, I think I shared it. Hello, everyone. I'm excited. I am Assemblywoman Speight, and I am joined by my queens, Assemblywoman Angela McKnight and Assemblywoman Britnee Timberlake. Welcome back. Hi.
Hello.
Hello. Welcome back to our second live stream, where we are conducting informative conversations about COVID-19 impact on our society. Before we go any further, we want to pause for a moment of silence to honor those whom we lost during this crisis. Thank you. We're grateful to be back here this evening. Again, we created this platform to present useful information to the public, acknowledging the impact that the current crisis is having on the various parts of everyday life. Tonight's discussion will cover social services and information about navigating a number of them. We know that understanding services and programs that individuals and families are eligible for can be difficult to navigate in normal times. We will highlight some available services that are beneficial for New Jersey residents to take advantage of. We're also honored to have some distinguished dignitaries with us who will come in their own way and highlight work that New Jersey state legislatures have been doing, as well as share information about the census. Assemblywoman McKnight will introduce our distinguished guests.
Yes. Thanks so much, Assemblywoman. So tonight we have a plethora of people on the panel. First, we have our Assembly Speaker, Craig Coughlin. Wave, Speaker.
Everybody.
Then we have Senator Teresa Ruiz.
Hi, everyone.
We also have Assemblywoman Verlina Reynolds Jackson with us.
Hello.
We have Commissioner Carol Johnson.
Hi, everyone.
And last but not least, we have Keisha Burnett, who is the Essex County Division of Family Assistance and Benefits.
Good evening.
So first, we will hand the Zoom over to our speaker, Craig Coughlin, and he's going to discuss some things that the legislator has done to create provisions for New Jersey residents to mitigate the fallout of COVID-19. Speaker.
Thank you, Angela. Thank you, and thanks so much to Assemblywoman, my colleagues, Assemblywoman McKnight and Speight and Verlina Jackson, Reynolds Jackson, I should say. Verlina is the first name, and it's a privilege to be on with Senator Ruiz and Assemblywoman Timberlake and the commissioner as well. And thanks to everybody out there who does so many good things. People who we have finally, I think, come to appreciate their real, true contribution to what it is that we do. There's people who work in hospitals for sure, and people who are on the front line as the first responders. But folks that we sometimes don't think about, like people who work in grocery stores and people who work at pharmacies and people who make us able to be doing the things that I like to say, the Coughlin family doesn't hunt. So if the truck drivers weren't there to drive the food to the store, and the grocery store workers weren't there to do it, we'd be in big trouble. So thank you to all of them, and make a shameless pitch for the fact that we raised the minimum wage, and we'd probably all pay triple now to make sure that they came to work today.
Absolutely.
So thank you to all of them, and thanks for doing this. Thanks for bringing us together, and everyone who's watching. I hope you're all well and your families are well, and please make sure you take care of yourself. So I'm very proud of the work that we've done in the legislature, Angela. I think we've done a number of things to put in place those things which are really important to the people of New Jersey, because they have to understand that they have a legislature and a governor who are prepared to work with them and for them, and make sure we have the building blocks in places to let them get through this incredibly awful time and incredibly difficult time. I've been around for a while. I've seen storms and I've seen tragedies, but those things were single event things. Something like this is something that it goes on, and we don't know when the end will come. And so for the people of the state of New Jersey who have to face the reality every day of getting through this with an unknown end date, and let's hope it's coming to the end soon. The things that we've begun to see in terms of the flattening of the curve are all hopeful signs. And I think we can rest assured that the governor is going to do everything he can to get us back as quickly as he can, and we're going to be partners in making that happen. But we thought it was important early on to establish some principles. And so in the first batch of bills that we did a few things. We established the ability for small businesses to tap into some EDA funds. And the goal there was to make sure that people had the ability to stay at work. Now, it's turned out that the wave has been pretty overwhelming. 650 or 700,000 people now applying for unemployment, something that is extraordinary and unprecedented. But our goal early on was to make sure that people tried to stay employed. We've also given the governor authority to work to try and provide some relief for people, and we've tried to protect folks from being evicted. We've passed bills allowing that to be stopped. The governor has worked and we've supported his proposal to have mortgage holidays or deferments, I should say. Britnee, Assemblywoman Timberlake, who's on, has a bill to do something similar for renters who we're looking at, because we recognize that people, good people are going to get in tricky places in a very short way. We also, in that first rash of bills, made sure that telemedicine, which has become increasingly effective and well used, both for physical and for mental well-being, because we can't ignore that side of the equation as we talk about the challenges that people face, would be universal. We've made sure that people wouldn't be laid off for confronting this disease. We've redefined family leave so that people can help serve to care for their loved ones or for themselves. And we continue to find ways to do that. We've given not a tax holiday, but we pushed back the income tax. That will let people have until July to pay their taxes, and gives them the flexibility to use some of that money that they might otherwise have to pay. We're going to continue to look at ways to support people to recognize what it is that they need. I think we put the building blocks in place. One of the most important things we did in that first voting session, by the way, was create a law to allow us to vote telephonically. That has allowed us to continue to operate while practicing the safe distance requirements and the stay-at-home orders that we've put in place to try to help beat down the curve. So I think I'm proud of the work that my colleagues have done in putting New Jerseyans first in terms of setting foundations and building blocks. And now it's time for us to build on that and to be prepared for the kind of things that we're going to face when we get to the point of thinking about a recovery, which I hope, and I know we all hope and pray will be sooner rather than later, because there's going to be challenges then. So many people have been affected, and people will be displaced. So many people have lost their jobs. Businesses will struggle to reopen. And so we need to make sure that we we're taking into account all of those things, and I have every confidence that my extraordinary colleagues, both in the Assembly and in the Senate, will do just that, because we get it and we care, and so to everyone listening, rest assured that you're talking to the A team tonight, excluding me, who are going to make sure that they're there on your side to get this done. So thank you all for joining in. Thank you for letting me have a few minutes of your time. It's a privilege to be with you. And I look forward to working shoulder to shoulder with the senator and with my colleagues in the Assembly to make sure that we do the important things that we've done. We do the important things that are necessary for people. One of the things I neglected to mention is the work. We passed a bill appropriating $15 million to support food pantries, something that's important to me, something I've had the privilege of working on with Senator Ruiz about to make sure that they have the support that they need, because we know and understand how critically important they are right now. So Senator, thanks for that hard work in addressing challenges with regard to SNAP as well. So we'll keep it up, and you folks at home, keep the faith, and we will get through this. It will happen not as soon as we want, I trust, but certainly, hopefully soon enough. And together, we'll be stronger. Adversity, time and time again, brings out the best in people. We see now how many people are really ready to sacrifice for each other.
That's right.
And I think, to my colleagues, keep up the great work, and thanks for letting me be part of tonight.
Thanks so much, Speaker. Thank you.
Thank you, Speaker.
Have fun.
Speaker. And you are on the A team, Speaker, okay?
All right.
Thank
I was
you for
waiting
your
for somebody
leadership.
to say. Right.
Yeah, you're on the A team. And thank you for your
Yes.
leadership and partnership
Have a
in
great
so many
night.
different things.
Okay.
Thank you.
Thanks,
You're
everybody.
capital A, okay, Speaker?
Okay, thanks. Bye-bye.
Bye-bye.
I know.
All right, Speight.
Well, as you know, Senator Ruiz is a part of the 29th district, my colleague, one of the best senators in the state. And it's hard to box her in into like a question. So, I would pose one question, but I would just definitely have to give her the floor. One of the things I will ask her, if she can speak on the existing social, economic, and health disparities that make the population more vulnerable, as far as the Latinos and African Americans, if you can speak on that. But, we give you the floor because you Senator Ruiz.
I appreciate that. So I want to thank the women of the legislature for putting this together and for allowing me to be an interloper this evening from the other house and participate in this it's just nice to see each other. We always complain about the long committee meetings in Trenton, and now I wish it was one of those long days where we are laughing with each other and voting on policy in the same room. But that being said, before I get into any details, I want to take an opportunity to thank the administration and the governor for the lead in bringing us together while we stay apart, for making tough decisions that some of us don't want to hear, which is, stay at home and stay safe. To all of our first responders, and in that I include our teachers and our stock shelf workers and our supermarket attendants. All of them, on behalf of my family, I am hugely grateful.
Right.
And I'm Puerto Rican, right? I get emotional. So everybody now who's watching is like, she really does have feelings. Look, you can laugh at that, y'all. Come on.
Hey.
The Latino community is really something that I think is going to make an extraordinary case study after this is over. And I think because, we're 19% of the population. Numbers are showing right now that we're 30% of the population that's infected. But if you peel back the onion and you break that down, perhaps we're only looking at a sliver of the community that has access to insurance. We're a group that within our community itself become have and have nots, those who have rights to certain programs and those who cannot access because they don't have a social security number. And so I wonder if our numbers are even greater if those opportunities were more open and available for our undocumented communities. And there's a lot. I'm here. I am experiencing fear. I can imagine that amplified by a disposition of not being able to connect with language, not having access to a vehicle, which is critical right now in certain circumstances for food sites when you're collecting food. And of course, we're doing that because health is the #1 priority and you want to avoid contact. So we're doing it for testing sites. A car is also critically important. So there's so many sub layers to this that I wonder if we're really capturing true numbers. The disparities, I think, would say are even greater because we have a whole sector that we're missing entirely. What concerns me most about this is that what I'm seeing, or at least for many of us, what I'm talking about are issues that I've been talking about for a decade. Lack of access in systems that were developed to not move someone out of poverty, but to keep them there. And I know this is hard to have a conversation about, and it's difficult, but it is the honest truth. And I think we really have to focus about engaging truth in our policy networks right now. This disease has floated up so many issues that we can't turn away from anymore. Are we lifting people out of poverty with programs that are available? Do we now know what learning loss means because it exists outside of certain zip codes, which has been, handcuffing our children for decades? We know we have a divide with technology. We know that if you live in a community that's saturated with pollution, that you're driven to asthma, that you are in a food desert that doesn't have access to healthy foods, that you can have subacute issues like diabetes and overweight that become all underlying issues for COVID-19. And what I'm saying is COVID-19 is not the issue. The issue is the structures that we have in place that COVID-19 are making all of us face and say, are we going to have an honest conversation? Because for me, I have to see the hope in this, that we get an opportunity to deal with the immediate and connect families to what they need, create a blueprint for what the new Jersey is going to look like, and redevelop ourselves in a government that's inclusive of everyone. I had this conversation with colleagues earlier, and I said, we got to look at New Jersey as this like mega engine that has all these levers, but every lever has to be looked at the same. One lever could be access to employment. One lever is getting small businesses back to work. One lever is corporations, but not one is less than the other. And so I think that has to be part of our not undercurrent. It's got to happen at the same time. We know that there's some people that have to deal with the immediate business right now at hand, which is saving lives, securing people, and making sure that we stay at home and we stay safe. But we have to have a broader conversation about what are the systems in place that have been failing communities for decades that now we can't turn our backs on any longer. That also this, in the midst of this darkness, provides us a way to lead towards light of creating new policy, because I think that the will and the fortitude is there. The speaker spoke about pieces of legislation at our last, and I can't even remember, I want to say it's last Monday, but all the days are coming together. In our last voting session, I sponsored a Work First New Jersey bill that changes the way we provide benefits. It could expand benefits to an additional 300,000 eligible immigrants. It could expand benefits to people who want to use Work First New Jersey as just a bridge to get out to employment. But what we realize that when someone is in the system, it's very difficult sometimes to get out because everything gets slashed so immediately that you can't stay on. I'm heading a task force with advocates that hopefully will be up and running within the next 2 weeks to talk about our ed spaces and what the new spaces look like, how we can support our teachers and get professional development. I got to tell you something, and I don't know if any of you, I know Assemblywoman Timberlake, your son is probably too young, and I know Assemblywoman Speight is dealing with this currently, but my daughter's preschool teachers have gone above and beyond, but it is an entirely different dynamic, and we are blessed. I understand the language. I have a tablet. I have a computer. I have internet. I was a preschool. I worked in a preschool setting before, so I have that connection. But it's a lot when you're on a conference call with mayors and you're trying to clap out the word of the day with your child. So I think about the person who doesn't have that, who doesn't have the resources or the skill set that I'm blessed to have with currently at this time. And that's where government has to fill the space. And again, this is not new. My neighbors have been struggling for this for years. When I scream in an education committee that my kids cannot be defined by their zip code, this is what we're talking about. So I'm really encouraged about leading and working in that task force with the Department of Education and all our stakeholder groups. One, to connect every child to the internet, to give every child a tablet. We're New Jersey and it's 2020. Let's do this and let's make it happen. 3, to create an immediate plan. 4, to really talk about how we're going to shift our summer school initiatives into rising programs, because we're going to have a cohort of students that if in fact, and I don't want to be the Debbie Downer here, but if in fact they do go back to school in September, because we don't know what this is going to look like, where are they going to be? Where will they be in their academic calendar? We know they're going to be behind. What are we doing for those districts and the teachers to facilitate a better environment that's more conducive to getting them up to speed? And all of this, everything I'm talking about, we know what the bottom line is funding and it's money. But I want to keep that at the forefront of this, because when we're talking about the ailments that exist along time, communities that are getting smacked down by this disease, it's because of lack of access and the inability for us to lift ourselves into a better quality of life.
Right.
Sorry.
Yeah.
Don't apologize.
Oh, go. We wasn't. Go.
No, you're speaking the
I'll
truth.
tell you to stop when you say something wrong.
The other thing is, I was very encouraged today. Staff was sending me quotes at the press conference today. This is for something that we have not talked about or haven't heard about it publicly. We know that a lot of our undocumented families that have ITIN numbers and pay taxes and contribute, and they contribute more than $580 million to the state coffers, do not have the ability to gain any resources through unemployment. I think the federal bills have unfortunately not been able to include them. I don't know if the second bill package has them in there, but we've seen California step up and we've seen New York getting ready to do something. I'm drafting a bill that's going to say, you've contributed to the economic stability of this. You should also be able to reach into it when you're in distress as well. And so I know that the governor did not make a commitment, but he said he was open to having discussions. And I'm looking forward to put together a bill that really lifts this other sector that's they're part of our family. They have businesses, they're property owners, they're in our school systems. I mean, this is what I think is the upside that we have here, is to take a real human approach to how we create policy in our different sectors.
Thank you.
Okay.
Thank you.
Let me tell you, she's Newark strong, Essex County strong, state strong, Latina strong. Thank you.
Thank you.
Thank you, Senator.
Thank
Timberlake?
you.
So thank you for saying everything that you said, Senator Ruiz. I too am just, first of all, sending condolences to everyone who have lost loved ones. I'm so sorry for your loss, from the Timberlake household and our family to yours. We have experienced loss in our family, and it's difficult. And I think part of the healing process is to be able to even get together and celebrate a person's life.
Right.
So there's a lot of things that are happening right now, emotionally, physically, economically. And, having the experts on today to talk about the economic impact and social services is just so incredibly needed. Senator, I too am also looking for the silver lining of this COVID, and a lot of things and policies that I've done in the past. Some have looked at me and even tried to put labels on me. Right, Senator? Oh, and well, is she this? Is she a social? Well, what is wrong with her? She's too progressive. She's this, she's that. No, the service and the social service system has been broken for a very long time, and we have to begin to repair it. And I think the silver lining in all of this
Can I just say, I don't even want to, I'm sorry, but I don't even want to say that the systems are broken. The systems were never created proportionately. And so that's why I'm joining you to say, let's stop and let's reset 100%.
Yeah, and that's very powerful that you're saying that. And that leads me to the professionals who are on now. And we know that we have started to add things to the social service system. I know people are getting an extra $600 a month if you're filing for unemployment on top of that. But there are some people who have even been trying to work themselves off of welfare. But there are certain policies that exist that are counterproductive to getting off it, to where, excuse my French, you're damned if you do, damned if you don't. Right. But that's just real talk. So how is it that we can, create policies, to what Senator Rice was saying, absolutely, and make sure that we're able to even close the digital divide? How about just as libraries are free, I'm of the belief that internet should be as well, and everyone should have access to it, because without having that, it kind of hinders that type of information. So introducing and going to the segment where we can talk about the social services and what is actually going on, and the increased need to expand those social services. Are we seeing a certain need coming from all over the state? Is it primarily certain communities, maybe low and moderate income, maybe Black and Brown communities, or is it just across the board? What is it that we're seeing, and what is the expanded need for social services? And also, are more people becoming eligible to take advantage of the services and the programs? What are the programs? The question is really packed. What are the programs, and how can people apply?
Yes.
I don't know if we want to start with Carol or Keisha, but the floor is open up to you. Please, we're here for the information and the knowledge.
Yes.
I defer to the commissioner right now.
Well, thank you, Keisha. And I look forward to Keisha's comments as well. I'm Carol Johnson. I'm the Commissioner of the New Jersey Department of Human Services. I'm delighted to be with you tonight on behalf of the governor, who cares a great deal about the public health challenge in front of us, but also the economic challenge, and recognizing that social services are going to be a key part of helping individuals and families today and going forward. And I really appreciate Senator Ruiz kicking off a conversation about what that really looks like going forward, because in many ways, we've been boxed in social services in the way programs have been defined by federal rules, where we've had to sort of check various boxes to be able to reach different populations. And so we really need a refresh and look at how these programs are designed and who they serve. I also, just a sort of foot stomp on something you said, at this critical time, we are also very concerned about individuals in our immigrant community because of the public charge rule that the Trump administration has put out, that has really tried to sort of create fear in the immigrant community about using public benefits, and the fact that that would have some impact on their ability to move towards citizenship going forward. And so that is a big concern to us, the timing of this event, while that rule is out there, and creating that distrust of public service and public benefits is a particular concern. But I should back up and start by thanking Assemblywoman Speight and Timberlake and McKnight for creating this platform. I just so appreciate the invitation and the chance to be with you here tonight. And to Assemblywoman Reynolds Jackson and Senator Ruiz, who are such great partners to us in the Department of Human Services. But I wanted to add to something that the speaker said earlier about essential workers. Keisha and her team and people like her in counties throughout our state are working day and night to make sure the people who need benefits are getting benefits. And it is critical to what we're trying to accomplish here. So many individuals, so many families, to your question, Assemblywoman Timberlake, so many families who have used our benefits in the past, know sort of what our social services door looks like. But there are a lot of folks whose life changed. There's a lot of folks whose life changed a month ago who don't really know our social services program and have many of the questions that you're raising. So we're gonna share a lot of information.
When are people getting unemployment? These are the questions that everyone wants to know, and what's the process? And as I know, the process changed a little bit.
So,
you have to apply for different payers.
like a lot of states, we have seen such a surge in unemployment claims and needs. We have paid out $1 billion already, but that doesn't account for the fact that there are people who are in line and who are frustrated. And my colleague who runs the Department of Labor is working round the clock to try to answer those calls, get those applications processed. But we understand the frustration, we share it, and we want to move that as quickly as possible. What I would say is that there's two things that I want to make sure, if folks are watching and need social services help, there's two things I want to make sure that you write down. One is NewJerseyHelps.org, NJHELPS.org, and I'll come back to what that is. And our phone number for our mental health cares line, which is 866-202-HELP, H-E-L-P, 866-202-4357. So let me tell you what NJ Helps is. NJ Helps is our online one-stop place where you can find out information and find out your eligibility for critical programs like health insurance coverage through our Medicaid program, food assistance through our SNAP program, and cash assistance through our programs like temporary assistance for needy families, general assistance, and what we call our emergency assistance program to help individuals who are having immediate emergency need with things like rent and the like. So that is the place where you can quickly find out what you're eligible for. You can do a quick screening online, and then you can apply online. There's a couple of things that I think are helpful for people who might have questions about this now. One, the $1,200 stimulus check that you may have just received in your bank account, or a check is on the way to you, does not count against your benefit application if you're applying for any of those programs.
Good to know.
Good to know.
Two, particularly for the Medicaid access, so for your Medicaid eligibility, the added $600 in the federal unemployment benefit does not count towards your Medicaid eligibility. The third thing that I think is helpful for folks to understand, because it might be a little bit confusing, usually we ask you about your income when we take your application for what your benefit eligibility is. And so you might think, well, I made a decent amount of money last month. I don't make money now because I was just laid off because my business had to close or my employer had to lay some folks off. So, but I made certain money last month. Now I don't make money. It's that what we care about is what your economic status is today, not what it was a month and a half ago. So we're going to try to move as many people as we can into these critical programs to support individuals at this really critical time. And so I'm happy to share any of the details, but all the details about the benefit programs themselves are on NJ Helps, and it's a way to really get quick access to those services. I would say anytime if you have questions or you aren't sure what you're eligible for and you need to talk to someone, Keisha's team and others at our county boards of social services can help. They are obviously, like all of us, trying to social distance in their office and work remotely. And so bear with us on the phones there. But if you use the online application, and we have tried to make the information that we need as simple as possible, if you use the online application, that is the way we're going to get you benefits as quickly as possible. And then I would just share a couple of other things that you all had noted would be helpful to folks. We also, as Senator Ruiz knows, we have created an emergency childcare program, which is essentially a subsidized benefit for essential workers who need childcare services at this critical time. So we know how important it is that individuals who are essential workers who a month ago, their kids were in school when they were at work. Now they have this unexpected expense of childcare to be able to continue to do their essential work. So we have stood up with at the governor's direction an emergency childcare program to ensure that those families can access childcare at this critical time. We are providing a subsidy for that benefit for essential workers at this time, and we are continuing to work to see how much revenue we have available to continue that for as long as we reasonably can. But we want to make sure that when we can, as we can, we're providing some resources to support essential emergency childcare.
People apply for that, Commissioner.
You can go to our website. At DHS, or you can go to emergency childcare. You can search New Jersey emergency childcare and you will find it there. We have a simple very simple application. And then we have organizations across the state that are called child resource and referral agencies. Someone from a child resource and referral agency will call you within 48 hours if you fill out that application and connect you to one of the centers that has been licensed and approved to remain open to provide childcare to essential workers at this time.
Wow, that's amazing, amazing.
We are really, our colleagues at our team we have had a considerable amount of applications, as you might imagine. So I'm very grateful to our team at the Division of Family Development who've been working around the clock with our child resource and referral agencies to process all those applications so that children can be in care and families can get that subsidy. We also, as I mentioned, have our mental health cares line, which is our emotional support line for individuals. I mean, it is a challenging time for all of us. The uncertainty, the anxiety is very difficult for everyone. And then just the complication, you know, of working from home and providing educational support to your child and trying to do everything that you need to do in your house. There's just a lot of strain and stress on individuals at this time. And so we have expanded our mental health cares line. That's our 866-202 helpline. And that's open 8 to 8, 7 days a week. And so it's a good, safe place to have someone to talk to. But if you need additional mental health services, they can also provide referrals to our mental health providers across the state. And as the speaker mentioned, you all in the legislature have done so much work for us that has been helpful in making telehealth available to individuals. And so we have now greatly expanded the use of telehealth and telemental health so that either by video or by phone, you can get that kind of support. And we think that's so critical at this moment, particularly for things like primary care, but really mental health. It's going to make a huge difference for folks to be able to access mental health at this moment. Sure. And then the last thing I'll say briefly, and to take any questions or turn it over to Keisha to talk about the county-based work, but I'll also raise our aging services. We are also the state aging agency, and we have spent a considerable amount of time really identifying our most at-risk seniors. So those folks we knew who were going to be vulnerable at this time. And we have all of our care managers from our Medicaid plans calling those at-risk seniors to make sure that they have their medicines, food, they have medical supplies, they have the things that they need to be safe, and that they're getting the kind of on-site support that they need, and we're deploying people as need be to those. We also are working with our county agency, area agencies on aging offices. Those are the groups that have always provided food like Meals on Wheels to homebound seniors. But they also ran congregate senior sites where everyone had lunch every day. That's not happening anymore. So we are working on delivery to those folks. But what we're increasingly getting, and the Assemblywoman knows this because Assemblywoman McKnight has done this, we are increasingly getting calls from seniors who are just scared and concerned about going to the grocery store or going to the pharmacy. And so we're working with NJ Cares, a volunteer network in New Jersey, to put together partnerships so that we can help support individuals who need that kind of support with volunteers from across the state. So we're continuing to identify issues and challenges and places where we can help and put resources together to solve the immediate need, while we also think prospectively, as the Senator mentioned, about what our system looks like going forward.
Wow, Commissioner, that is amazing. And just today, I was out with a group of volunteers and we just delivered 250 meals to seniors. So I know what you're doing. So thank you. And all the information you just said to everyone, thank you. Keisha, I want to hear what you have to say now.
Okay, well, first of all, I would like to say it's an honor and a privilege to be on this panel with such distinguished people. Thank you, Commissioner, for your kind words. More importantly, I would like to thank my staff at the Division of Family Assistance and Benefits, known as DFAB, who have a heart and a passion, who have had some serious challenges personally, and they are coming in. I have worked out where they can now work from home, having flex schedules. They are concerned about what they do because they realize they are first responders. I really want them to know how much I appreciate them. And I'm very grateful that they're willing to do what they're willing to do. Since March 18th, we have received 13,650 new applications.
Wow.
And so where what the commissioner discussed about, we've gotten just about every federal waiver. It helps a lot, but we still, people need to be a little patient. I know it's hard to say in this time, but you need to be a little patient because we're trying to take care of everybody's application as fast as possible. The other thing the commissioner talked about were all of the other restrictions, which would be if you were already receiving assistance, you now are no longer held to the research. We've already, your recertification dates, we've extended those. So there's no need to come in. Let me backtrack. In order for you to apply in the past, you would have to come in person. Now we tell everybody do it online. If you don't have access to online, we will take your application over the phone and we will ask your permission to sign your name that this is what you want, and we will handle it that way. The other thing that we offer, we have the SNAP, we have NJ Family Care, adult Medicaid for the disabled. We have, we handle SSI clients. We provide rental assistance. We provide, and especially now, unfortunately, with COVID, it has gotten very, very larger. I'm also the more keeper for the county, but we will pay for Medicaid persons and persons receiving SSI. We will pay the cost for the funeral. As the more keeper, I will pay for the indigent person. The other services that DFAB is now providing, we've linked up with all of the hospitals in Essex County. And so anyone who has tested positive and cannot go home, we have a hotel that we will put the person in for quarantine so as to not infect any other family members. We are also doing that for the homeless population, where I am also working with former Governor McGreevy with the prisoner reentry program, and I have placed 40 recently released inmates and also given them and taken their applications so that they can receive the benefits that they need. Where you used to have to come in for your EBT card, which is your SNAP benefits card, we're now mailing them out to you. So we're trying to do everything remotely. Well, we're not trying, we are. We're doing it remotely. We're just trying to pick up the speed. And I just ask that everyone be patient. We have a call center for those members of that team that are not physically in the building. They have cell phones that are hooked up to our systems so they can answer the call through the cell phone. And that number is 973-395-8000.
Say it again.
973-395-8000. And you can feel free to visit our webpage. I'll take any questions. But that's
I want to chime in because I'm part of the Essex County family, and it's such an honor to have Keisha as part of our team. And everything that she said is 100% true. Essex County is open. We're working. We are aggressive in our approach. We're trying to connect. Things look a little bit differently, but even in hearing Director Burnett just talk about some of the things of how we're connecting families, these are things that perhaps moving forward we should consider doing. Why not mail EBT cards? Why not use these things to connect people a little bit more easily that we're doing now because we have to, but having it go out. I'm just so proud to be part of the DiVincenzo Putting Essex County First team. I have to give that shout out because we like to set the stage and the model. And I wanted to go back to testing because I don't know if this has been discussed anywhere. We do know that our federally qualified health centers will get, you can walk up, you can go in and you can get tested at those sites regardless as to whether you have insurance or not. So I just wanted to make that available. In Newark, we have a few. My office, I have to take a personal opportunity because others are upping their staffers. We are not physically in our office, but our office is open, our email is running, and our phones are being answered. We're trying to help. And I just want to give a special shout out to Yvonne and Verilise who have gone above and beyond in trying to make sure that our Senate office is still helping and aiding.
Thank you so much, Senator. And just as Essex County is on the forefront, I must, give a shout out to Hudson County and Verlina.
Oh, there it is. There is the
your
little
county. How and how we are doing amazing work. So yes, we're behind you, Senator, but we may be number one after the census. But
we're working hard. Don't forget, y'all, Essex County 2020 census.
Yeah. Assemblywoman Verlina is going to be talking about the census soon, so you make sure everybody stays tuned for that.
Yeah. So all of the information that the commissioner has said, as well as Keisha has said, we are doing that here in Hudson County. It's amazing. And Verlina, I want you to chime in to talk about how your county is implementing such services for the people down in Trenton.
Absolutely. So our county executive, Brian Hughes, has done an amazing job. So just a quick fact check. I used to work at Mercer County Board of Social Services, and I was a social worker. I did emergency services for about 10 years. So big shout out to all the people at McBoss. They are my staff, they are my family, they're my friends, and we're still connected today. Everything that Director Burnett said is true. People are coming in because they know the services that need to be provided. My assembly office has been flooded with unemployment questions, and we're working very, very diligently trying to get people access to the benefits that they need. Now, how quickly we do it, that's on the unemployment side, but how we respond, I believe that's our responsibility. People want to know that you hear them, you've got their complaint, and that you're trying to do something about it. So I'd like to thank my staff as well. Leona, Ed, my chief of staff, is doing an amazing job with the census. And I just want to go into say everything that we've talked about, from the Commissioner Johnson to the Director Burnett, all goes back to our federal dollars. We can't stress enough how important the census is to complete. When we look for that hope, this is it right here. When you say, what can I do? It's the census. When we look at how much money we get for our healthcare services, it's directed back to population. Then the formulas that they develop, it goes back to population. The federal didn't take into account the states and the municipalities, how we're going to function after this. Again, this is our opportunity to make sure that we get counted. When we talk about our EMS services, we're going out, they're on the front lines. When we talk about our hospitals and how they need funding to maintain, whether you're a profit or a nonprofit, they still go back to the census for funding. This week, the census is talking about healthcare, and what's on the line is over $700 billion. I said that with a B. So I want our audience to really know how much money we're talking about. And each household has a responsibility. And I feel like not just us on this panel, but anybody that's listening, you're that trusted voice in the community. When I say it literally took me like 3 minutes to complete the census, it's so simple, it's so easy, it's safe, and there's no question about immigration. It's really easy. You can do it on your phone. You can call. I want to just give you the 1-800 number. If you want to call, we know we have some seniors that might not be techie savvy. You can call on the phone, and the number for English is 844-330-2020. And if you want to do it in Spanish, you can. The English number is 844-330-2020. The Spanish number is 844-468-2020. And I'll say it again. The Spanish number is 844-468-2020. And if you want to do it online, you go to My 2020 Census, that's CENSUS.gov, and you can do it online as well. We're looking to ask Congress to extend for another 120 days because of COVID-19. But if we do our part now, we can make sure we get it in just in case we want to go with Plan A versus Plan B. Plan A is always for us to make sure we reach out. Children are undercounted, and seniors as well. I feel like our senior population right now, we can't get to them, but I think that's where we step in and say, Nana, did you do it yet? Do you need help doing it? We can call on the phone and do that. And again, it takes all of like 2 minutes to do. It's not hard. It's not a lot of questions. It's really, really easy when you talk about the funding that we're talking about receiving for New Jersey specifically. If we're talking about WIC, we're talking about the census. If we're talking about maternal health that we've been beating up and trying to break down these barriers and get more funding for, we're talking about the census. If we're talking about Medicare or Medicaid, we're talking about the census. If we're talking about, again, trying to make sure we can get prescriptions and eyeglasses and all those things to make us healthy, we're talking about the census. If we're talking about cancer, we're talking about the census. If we're talking about college, we're talking about the Pell Grants, and we're talking about talent, and we're talking about EOF. We're talking about the census. And so I want to give a big shout out to the class of 2020. I'm so super proud of you. I want to make sure that that we see you, and we want to make sure that we have another generation to come behind. If you're talking about schools that need to be rebuilt, we're talking about the census. So again, I can't stress enough the importance of the census. And when we talk about our congressional representation, again, it goes back to population. We have to make sure that we protect them, protect your Congress people, and make sure you fill out the census. Talking about redistricting, we're talking about the census. Fill it out, do your part. It's more than just voting. The census is just as important. And the good thing is that it comes attached with billions, with a B on it, so that we can get the funding that we need. And we don't want to leave this into anybody else's hands. So again, it's easy, it's safe. You'll probably start to receive these little postcards that's coming out in the mail. I know I'm working with the League of Women Voters. I know that we're sending them out also to all of our seniors that we deliver with Meals on Wheels to our senior programs. Again, just trying to encourage people to complete the census. Is once every 10 years. So if you can do this, we can do anything. And again, we're going to be stronger. We're going to come back, and New Jersey is going to be stronger than it was before. So thank you so much for this opportunity, to my assembly colleagues and to the administration. We can do this without you. So fill it out, get it done, and then we'll stop calling you.
Verlina, preach. Great job.
Would you mind if I say one thing in response to it, which is just thank you for your impassioned plea there. As someone who runs a program that I know more and more New Jerseyans are going to need in the days ahead, and who's going to need the resources to be able to pay for that, and who knows that for decades, New Jersey has been a donor state. We've sent more money to DC than we've gotten back. We're now the epicenter of this crisis, and we need those resources to be here in New Jersey. We need Washington to step up for us, and the census is part of that. As hard as the governor's fighting, all of us in New Jersey can fill out the census and do our part to be part of the solution. So thank you so much for that.
And don't we want to reward our teachers and first responders? I mean, again, we're looking at really like federal cuts to them if we don't get the funding. And I think, when they put their lives on the line, and I know some of my parents that are doing the homeschooling, you appreciate your teacher 1,000 times more. And so we should make sure that we, you know your skills, your talents. It's time that we pay them what they're worth. And a part of this, again, is the census. And so we're strong in numbers in New Jersey. I think up until this week, we've been #1. So we slipped a little bit, but I'm hopeful that we'll come back and we'll be #1 again. So everybody just fill out your census. We really need you, and we're counting on you.
Thank you. So I have a question for the commissioner and Keisha in reference to healthcare. Commissioner, can you discuss any provisions that have been made to expand access to healthcare through programs? What's covered, who's eligible, and how to apply? And then Ms. Burnett, are there any other healthcare related programs at the county level that people can access?
Well, at the county level, not at this time. We're, basically just dealing with NJ Family Care, but not at the county level at this time.
Okay. No
I just want to jump in from Mercer County. I did contact them. The Mercer County hotline you can call is 609-468-8296. Again, for the Mercer County hotline is 609-468-8296. Or if you have any questions or concerns about your TANF, your SNAP, or your Medicaid, you can also contact Chris Harcart, and I'm going to spell it really, really slow. So it's CHARCAR at McBoss, MCBOSS.org. Again, it's Chris Harcart at McBoss.org, which is CHARCAR at MCBOSS.org. And so I know our staff is there and they're ready to take any questions or concerns and help people get benefits.
Great. So I'm going to give you one more website for folks to write down, which is getcovered.nj.gov. So getcovered.nj.gov. Now, this is the website that will get you to the marketplace where if you just lost your job and your health insurance with it, you may be eligible for federally subsidized healthcare that will help you pay your premiums as well as cost sharing on your plan. Now, the governor had asked the Trump administration to open enrollment for everyone at this time, to reopen enrollment in the federal marketplace. The Trump administration decided not to do that. It's really confounding why that happens. It would be so easy to open it right now and help everyone who needs health insurance get access to health insurance. But if you had healthcare coverage in your job and you lost your employment, that is what's called a qualifying event, and will allow you to go to getcovered.nj.gov and get access to a special enrollment period to look at those options on the federal exchange. New Jersey Medicaid is available for application any time of year. There are not limited times of year the way there are for the federal exchange. So anytime you can come to New Jersey Medicaid for screening. And if you were to go to the federal exchange and apply there and say, for example, they looked at your application and said, oh, you're probably Medicaid eligible, they'll send that right back to us and we will take care of it from there. So that is a one-stop place for you to go. But all of that points to why it will be so important that we do the work that we're doing in New Jersey to run our own health insurance exchange. So the governor has and the legislature, you all moved legislation to give us the authority to do that. And we're working on doing that for the next enrollment period. It's really unfortunate we don't have it now because we would have been able to open enrollment again on our own.
Gotcha. Thank you. Speight, can you talk about the SNAP?
I think they answered just about all of the questions, but just one question. I think you might have answered this. Can an increase in the supplemental and unemployment benefits make people ineligible in any of these programs?
So the added dollars in the federal $600 add to your unemployment benefit, when Congress passed that bill, they specifically said it does not count for the purposes of determining your eligibility for Medicaid and the Children's Health Insurance Program, but not for any other program. So it still counts for other programs, but not for Medicaid or the Children's Health Insurance Program. Okay, and then just to clarify, the $1,200 stimulus payment that everyone is getting doesn't count for any of the programs.
So if they were getting SNAP prior and the increase, they was to get the increase, with the increase, it's a possibility that they won't qualify?
Well, it depends. If you were getting it before and then you lost your job, then you may have a different level of income coming in because your state benefit for unemployment might be a little bit lower than what your income was. Right. So it just depends on how it nets out for you. But it might impact the level of your SNAP benefit, but it doesn't automatically disqualify you. People should still apply and come in and take a look, and we will work with folks to figure out what they're eligible for. I would also add that we are continuing to push the federal government to give us additional resources. So we were able to do $70 million in additional SNAP benefits between the end of March and the beginning of April. Families that didn't get the maximum benefit, that don't get the maximum benefit, we were able to give them the maximum benefit with some additional resources we got out of the stimulus package. And we're continuing to push with our delegation in DC to look for more of those dollars, because we think more dollars to SNAP, more dollars in folks pockets to be able to get food and afford groceries is key here.
Yeah, our congressional delegation is doing a phenomenal job. Bonnie Watson Coleman, Senator Menendez, and Senator Cory Booker, they're really out there fighting for us to get additional dollars. So thank you so much to all of them.
Thank you, thank you. So, ladies, Speight and Timberlake, I believe they have answered all the questions. I'm, reviewing them, and you all have answered all the questions. So, we would like any final thoughts to tell people who are watching, who's listening, or if anything else that you haven't spoke about and you want to let the people know, please do. Speight and Timberlake, please let me know if there's anything else you ladies want to say as well.
All right. I just have one last comment, which is, these social services programs exist to help folks. So if you're struggling, please come and find out what you might be eligible for. We're here to help. That's what these programs exist for. Don't hesitate, ask, because this is a critical time and people who are struggling shouldn't struggle if we can get them enrolled in programs.
I want to thank everybody for all the work that you're doing and for including me in this conversation. And letting me be part of the process of a solution. I'm grateful to the power that's on the screen right now. And if anyone's looking, there's a trend that's existing across the screen. Women know how to get the job done. I'm just, plugging it for women across the board. But I also want to say we thanked a lot of groups, and I want to thank everyone again who's going above and beyond in so many ways. I also want to send a message to our students in the state of New Jersey. Our children are undergoing a lot of emotional feelings that are new. My daughter's 3, and she understands that there's a virus. Wearing a mask for her is something new. And so I just want to send a lot of love to all of our kids and a lot of encouragement to all of our parents or people who are raising children in their families, just to say that we're with you. We understand. We hope we can be as helpful as possible. We're not perfect. We're human beings, but I think we have the ability to come out of this to really show the power of the human love in a connective way that we haven't seen ourselves like before. So thank you.
Thank you, Senator. Thank you for being here with us tonight and sharing your thoughts. We appreciate you. We know that you work so hard, in the other house for us, and you're also on the ground. So it is our honor to have you here with us tonight. So thank you.
Final thoughts on just completing the census. It's easy. It's confidential.
Yeah, because we want to be Hudson County. Specifically Jersey City, I'm just saying, We
just, it's just important when we talk about all the social service programs, when we talk about housing, when we talk about barriers, the digital divide, when we talk about education, we know all of these things are linked back to funding. And I think the senator said it best. How do we combat this? We complete the census and this is just one tool. Among some other things that we need to do, but when we're talking about billions with a B on it, this is something that we can do and contribute. So I thank you all for allowing me to participate on this call, and I look forward to working with you to make sure that New Jersey comes back better and stronger.
I'm sorry, I would totally be, that if I do not do this, quiero coger una oportunidad ahora. Pasamos esta hora y se me olvidó completamente traer un mensaje en español. Disculpa si el español mío está un poquito no tan desarrollado como el inglés, pero quiero que ustedes sepan que las mujeres que están aquí y the Assembly Speaker que estaba con nosotros más antes, nosotros estamos trabajando inclusivo juntos para poner una agenda pública que va a proteger a nuestras comunidades y a nuestra familia. Las oficinas de nosotros están abiertas, las oficinas de nosotros están presentes, pueden llamar. En cada de nuestras oficinas vas a encontrar una persona que, si acaso tú no hablas inglés, que puedes comunicarse con una persona que hable español. Estamos aquí para ayudarlo emocionalmente, con recursos y disponible para tener conversación con ustedes a niveles que quizá podemos conectarlo con servicios públicos en una época que necesitamos tanto. Yo estoy sumamente orgullosa a compartir con estas mujeres que se encuentran aquí esta noche, porque trabajan, protegen, apoyan y siempre están presentes para nuestras comunidades, nuestra familia, nuestra juventud, y es un orgullo compartir con ellos. De parte de todas nosotros, quiero saber que nosotros sabemos que esto es una época que nunca los hemos encontrado antes, que juntos podemos salir de esto más fuerte que cuando se empezamos. So, que Dios los bendiga a todos.
Thank you.
I also just wanted to thank, oh, I'm sorry. I just wanted to say thank you for having me on this. I feel like this is such a powerhouse room of legislators. And I feel like we in the administration, particularly me in my role, I'll speak for myself, as we run as fast as we can and we lean into solutions here, I know that I feel confident that we always have your partnership and you have our back in these tough fights. And so I thank you so much for being such leaders in the legislature. It makes a huge difference to us in the work that we do across the state.
Thank you.
I want to say thank you. It was an honor to be able to participate. I would like to repeat the telephone number, 973-395-8000. I'd like to repeat the website, njhelps.org. I would like everyone to know that DFAB really cares about you. We're really concerned about your needs. All you simply have to do is reach out. We will get back to you. I also want to thank DFAB staff again, my first responders, because it's not about it's about we, it's about us. It's about what Essex is all about. I'm sorry, ladies, it's still going to be Essex first, but thank you.
Yes.
Speight?
Before I go any further, Shadea Bennett, I know she's watching. That's my chief of staff. Thank you so much. She has put so much work into this. She's been answering the calls. She's been doing so much by herself. So thank you so much, Shadea Bennett, because I couldn't do it without you. But just thank everyone for coming on here tonight, because guess what? You made it possible. But, you know, I have to thank my Essex County family. Thank you so much. I'm sorry, Angela, but Essex County is in the house tonight. And my colleague, Senator Teresa Ruiz, thank you so much. But to our viewers, thank you for watching. Hopefully you learned something on tonight. If you need to reach out to us, you could also email our office. One thing I have to say, we are all in this together. Love is what love does. Love on each other, be kind, be supportive, stay home and stay safe. Angela.
Timberlake. Have anything else you want to say?
Yeah, I just want to say thank you to everyone for being on the panel, a panel of power women, and thank you for giving the information and sharing it to the population, because, you know, so many people are hurting right now, and they're hurting in so many different ways, physically, mentally, spiritually, and we just want you to know that we're here for you, and we're pushing out as much information as we can to you, and it's gonna take all of us together to get through this. Continue to hold on. Please continue to practice social distancing. And thank you so much to Commissioner Johnson and to Director Burnett. Thank you so much for being on and for sharing what people should do if they lose their job, what people should do if they're laid off or don't have food in their fridge, where they can go, what are the resources, because these are very real questions that have always been in existence, but have now risen to the surface, and people who were previously gainfully employed now find themselves going into the system and having to navigate it. And I'm so grateful that, again, the silver lining of COVID is that because of that fact, people are going to now be able to change the way in which the social service and the benefits are actually provided. So thank you so much. And that's my 2-year-old and also my cue to go.
Thank you.
I hear you. Did you see mine? And you keep saying silver lining. So she's like, yeah, what's going on?
Miss Silver, she's so beautiful. God bless her.
I want to say to my chief of staff, Regina, who has been taking all the information that you ladies have been pouring out and putting it in the comments, answering people's questions. So Regina, you are my right-hand woman. I appreciate you. And to everyone that's watching, I'm going to give you a call of action. This video right here should be shared to your network so that your network can see this video and see all of the information that's right here on this video so that it can help them and it can also help their family and their friends. So please share this video. It's a plethora of information that so many of us have shared on this. So to that end, we will be back next Thursday at 7:30 with a brand new panel with some more information for you. So thank you so much and God bless.
Thank you.
Good night, everybody.
Good night. Thank you.
Good night.